Welcome to this Q&A from the Fertility Alliance. Today for Fibroid Awareness Month, we're going to be talking about fibroids, and we've got with us Professor Adam Balen from Leeds, who's going to give us some basic fibroid facts. So Adam, what are fibroids?
So fibroids are benign thickening of the muscle of the womb, of the uterus. They're fairly common. About 40% of women develop fibroids once they get to the age of 40. So actually, that's quite an easy number to remember. So they're commoner than people think, and many people have fibroids without even knowing that they do have fibroids. So they're a benign thickening of the muscle of the womb that can occur either within the heart of the womb itself, and they can project into the inner cavity of the womb. So that's the endometrial cavity where a pregnancy should develop, and it's there that they can affect fertility. They can grow within the muscle of the central part of the muscle of the womb, enlarging the womb, and that often leads to discomfort, pressure symptoms on the bowel and bladder, and heavy painful periods, which is a common complaint. And of course, heavy painful periods are not only very difficult to deal with, they lead to other consequences such as becoming anemic. And fibroids can sometimes project into the tummy cavity outside of the womb. So they're classified by where they are. You can see them on an ultrasound scan. Sometimes we do an MRI scan, but an ultrasound usually gives the information that we require when assessing a woman with fibroids. They tend to grow slowly over time. They can enlarge during pregnancy and cause problems during pregnancy. So particularly large fibroids within the muscle of the womb that grow during pregnancy can be associated with pregnancy complications such as miscarriage or premature delivery. So they can cause significant problems and also increasing pain and symptoms during pregnancy.
So
Yeah.
I was going to say, is heavy menstrual bleeding the most common symptom? Is that what you'd notice if they were causing a problem?
Yes, for most people, yes.
And what else might you notice?
So pressure symptoms, pressure on the bowel, pressure on the bladder, needing to go to the toilet more frequently because you feel that pressure. And of course, that can vary through the cycle because fibroids are affected by the hormones of the menstrual cycle.
And do they always affect fertility, or can you have them and not have any fertility problems at all?
Very good question. And there's a lot of debate about this because we know that lots of women conceive naturally with fibroids, and the fibroids may never even be picked up at any time in a woman's life. So, yes, they can exist without having any impact on fertility. Um, the evidence that we have with respect to fertility is that once they grow to a size of more than 3 or 4 centimeters across, once they start distorting the overall shape of the womb, or even if smaller fibroids are projecting into the endometrial cavity, so the internal part of the womb where a pregnancy would develop, that's when they affect fertility, and that's when we have to have a discussion about how they should be managed.
And when you say managed, what does that mean? What happens?
Well, management depends really on symptoms and the desire for a pregnancy. So if we pick up fibroids in somebody who's not wishing to conceive and they're troubled by heavy periods, then we can give medication to suppress the menstrual cycle and a range of drugs that we can use, but they're all either contraceptive or contraindicated if you're trying to conceive. Um, and always remember the consequence of anemia, so ensuring that We check to make sure that somebody isn't anemic, because taking iron and folate supplements and general vitamin supplements can reverse the symptoms that can be very debilitating, lack of energy and problems like that. Now, management in the context of fertility usually means surgery. And surgery isn't without its risks. If you have a fibroid projecting into the endometrial cavity, you can do a hysteroscopic procedure. So a hysteroscope is essentially a very fine scope that is passed from down below through the vagina, through into the cervix to actually enter the uterine cavity. And then there are various attachments that can be used to shave off a fibroid that's projecting into the inner part of the womb to make the inner part normal. The risks: bleeding, infection, and adhesions. So adhesions is scar tissue. So there's always a risk whenever you're operating within the womb that you may leave scarring. So it needs to be done by somebody who's appropriately trained, because it needs to be done very carefully. The larger fibroids that might be distorting the overall womb itself are usually removed either by an open operation or laparoscopic surgery. So it depends again on the size of the fibroids and where they are. So a laparoscopy or a laparoscope essentially involves passing a scope usually through the umbilicus, so through the belly button, in a procedure done under general anesthetic to look inside the tummy cavity. And again, additional instruments can be used to cut away fibroids from the womb. Sometimes, particularly when they're very large fibroids, you have to do an open operation, cut into the womb to excise the fibroids from the heart of the womb. That again brings with it risks of bleeding, infection, scarring, and sometimes it's difficult to reconstruct the uterus. And occasionally even a hysterectomy is required because the fibroids are too big or can't be removed without the whole womb having to come away. So that's obviously something that we don't want to do in a woman who's wishing to conceive.
That all sounds very serious. Is it always that complicated with fibroids, or is it sometimes quite straightforward to kind of conceive if you know you've got fibroids?
So if you've got small fibroids that aren't distorting the womb or projecting into the inner part of the womb, then yes, you can conceive, and that's a discussion that we would have. I suppose it depends upon all of the other factors that come into play. I personally am quite conservative, so if I'm having these discussions, I'm not a fan of surgery unless you actually absolutely have to do so. There are other ways of managing fibroids as well that if you've got fibroids, somebody might talk to you about uterine artery embolization. So that's a way of blocking up the blood vessels that supply the whole uterus itself, which can be effective in managing the symptoms of fibroids. But these days we advise against it in somebody who's wishing to conceive, because you can easily see that if you're affecting the blood flow through to the uterus, that's actually critical for the development of a pregnancy.
And just one final thing, if someone's trying to conceive and's got any of those symptoms like the heavy bleeding or the feelings of pressure, would you advise them just to go straight away to seek help?
Yes, yes, yes. I mean, if you have any concerns, ask your GP to refer you through to a local gynecologist, and preferably one with an interest in infertility, so your local fertility clinic. And that's when you'll get a careful evaluation. As I said, usually an ultrasound scan and advice about medical or surgical management.
Professor Adam Balen, thank you so much for that quick update for us on fibroids for Fibroid Awareness Month. You can find more of our videos on our YouTube channel, lots of Q&As on different subjects. So go to the website and you can find there a link to the YouTube channel. Thanks very much, Professor Balen, for this update on fibroids.